righty, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. And back live in the studio after another trip wherever he goes when he goes is Bill Kearney. How you doing, Bill?
Maybe I'm CIA.
You don't know where you never know.
This trip really was Washington, D.C. So
oh, there you go. See,
but I was there long enough to tell you that I would never want to live there. I mean, it was. I had a board meeting there on Saturday, and we went in on Wednesday because I had a meeting with Congressman Mike Thompson from our area on Thursday. And while we were waiting for him, of course, we took a trip through a tour through the Capitol. One of his employees was kind enough to take us through Congress and the Senate and the Supreme Court and through all the various tunnels and back around. I was supposed to have a half-hour appointment with Congressman Thompson, and it ended up being 10 minutes. And then one of the aides was knocking on the door all the time saying, "You have another appointment right at noon." And
wow.
So we were addressing some pharmacy issues that we've talked about on this program many times. One of them was transparency from the pharmacy benefit managers, meaning the people that pay us to fill the prescriptions for the insurance company, and they are taking sums away from our reimbursement after they tell us that we made so much money as we reconcile the prescriptions, and then 2 or 3 months later we find out they've taken back another couple of $1,000s. So at least what we were trying to do was trying to get there to be some transparency so we would know when we filled a prescription if how much money we were losing, if we were losing money. And I also had a board meeting on Saturday, which the executive officer of the National Community Pharmacists Organization met with our board from the Compliant Pharmacy Alliance. That we have 8 people representing 1,100 stores, and they wanted to get our feelings on how we survive in this environment of not even knowing what you get on prescriptions. There is an issue called DIR fees, which are direct and indirect remunerations that CMS or Medicare had passed, expecting that money to go back to the drug company, and instead it came out of us instead of out of the insurance company. And it continues to go on. Then there was another ruling that another bit of legislation that would allow pharmacists to be included as pharmacy service people, that would allow us to get reimbursed as if we were a physician, because many of our states, and California is one of them, that allows pharmacists to take another tier of courses that allows you to be prescribing medication, to implement hormone contraceptive therapy, to implement travel sickness and prescribe prescriptions for those people, to implement naloxone therapy, which is a agonist to opiates. So if a family member knows that they have a loved one or a friend that's about to overdose on an opiate, they can reverse that with an injection. It's not free. I mean, it has to be paid for, but doesn't require a prescription. The physician or the pharmacist can actually give that to a family member in case that happens. The amount of deaths that we have in the opiates now have gotten to be the most tragic way of death that there is, and the population that is dying from opiate addiction. If you listen to our program, you hear about this a lot. But when I was on the airplane coming back from Washington, D.C., or we were, my wife and I, they enumerated about in the Washington Times of how many people were killed in the state of Virginia by traffic accidents in the past year. And there were more people that died from opiate deaths, from overdosing on hydrocodones and oxycodones and those kind of drugs than there were in automobile accidents. And if you drove the freeways in Virginia and Maryland and Washington, D.C., you'd be amazed that that figure is as great as it is. that's happening all over the world, and of course all over the United States. And although I know some of our audience are marijuana users and medical marijuana users, the state of Oregon just opened their recreational retail outlets for people who wanted to buy recreational marijuana, and they did as much in a week as the state of Colorado did, I think, in a month. I think it was $15 million. And if you don't think that's a pathway drug, that's your business. I happen to think it is. So everybody takes a risk. And on the other side of the phase, and I've been on marijuana advisory boards with physicians, alcohol can do the same thing. But the opiates have gotten out of control, and now we have more and more people using heroin. We just... there was I can't remember the gentleman's name. He's 27 years old, Ryan Sykes or something similar to that. Played for the University of Iowa. He grew up in a hometown not far from mine, and he just died about a month or so ago. Very promising, was drafted by the Giants and played professional football. But he had a broken shoulder and a lot of injuries from football, and he passed away about a month ago or less. And they found out yesterday that it was a combination of methadone, which is a substitute for heroin that's used many times as a regulation chronic pain reliever because it's inexpensive. It's very difficult to control, and then hydrocodone together. And he said it was an accident. He didn't do it on purpose, but when you're in that much pain, and frequently retired athletes are, or athletes that are still continuing to play are, they have a tendency to over-medicate themselves, and of course that happened with this gentleman. But it's happening all over the United States. I think Indiana is the most robbed state for hydrocodone medications in all the states in the union. And it's one of those things that, unless we do something about it, the County of Lake is going to do an opiate intervention type thing where we focus on getting people off opiates. And Dr. Karen Tate, who's a public health officer for the County of Lake, is going to help implement this. It starts either this month or the 1st of next month, I think the 1st of November. And I just got an email about it when I was on the airplane. So I think that's very timely. I think it's something that has to be done. I think that's something that we have to recognize as being a huge issue. And if you haven't had a hydrocodone or oxycodone or a narcotic addict in your family or a friend of yours, you're very, very rare, because almost everyone I know has somebody. And we dispense those medications, and we go through the Department of Justice to make sure that these people are getting it on time. We don't have the records of the patients that we fill these prescriptions for. Only the physicians do. So the only thing we have to rely on is the timeline that they're getting the prescriptions filled. And if the physician feels like they need it for their chronic pain, then we're under the obligation to fill it unless we know that it's being misused or overprescribed. If somebody comes to us and says, I'm taking it 4 times a day now, the doctor told me to go ahead, only the prescription said 3 times a day, we can't refill that prescription early, or we can't, even if the doctor writes a new prescription for 2 weeks after he wrote that one and he doesn't say fill this early, and he writes it for the same directions, and that's a month's supply, that's all we can give you. So it's very hard for the patient to understand this when we're filling the prescription. So I know we talk about opiates a lot, and I know that it's boring to a lot of people who don't have that problem and that issue. I'm kind of at a loss for bringing up some things that I would have been studying more for had I been home. But we have other things to talk about. One thing is to make sure that you get your flu shots. We're having a clinic at the Senior Center in Lakeport on tomorrow afternoon from maybe it's 10 to 2, 10 to, it's in that area that's posted within the Senior Center. So it's in the morning and a little bit of the afternoon. That will be our last flu clinic. I know the hospital has been giving out free shots at the fairground, and I know other people are giving out shots. Just walk in our pharmacy, tell us you need a flu shot. We will get it for you. Fill out a minimum documentation on whether you're sick today or when you had the last flu shot or if you're taking chemotherapy. We'll give you your shot. Those of you who are planning on getting together with your grandchildren and great-grandchildren and your own children that are infants in the next 3 months, or any time that you have a new arrival come into your family that's an infant, you need to make sure that you get a Tdap shot. That's tetanus, diphtheria, and pertussis. The reason is there's no immunity for that little baby. And pertussis is whooping cough. We never used to worry about whooping cough. We were immune to getting that disease because everybody got their whooping cough shot when they were young. That no longer is the case. In fact, if you're a mother, and we've talked about this before, every time you get pregnant, if it's 1 year after the other, you have to have a Tdap shot to protect the immunity of that newborn. And the newborn can't get a shot until 6 months old, so they go completely unprotected. So if you're a grandparent or a parent that's not the mother that has had the shot already, then you need to make sure you get a Tdap. Remember, it includes tetanus. Even if you got a tetanus shot 6 months ago or 3 weeks ago, you still need to get the Tdap shot. So again, we do those in the pharmacy. You do not have to have a prescription. We have a collaborative agreement with a physician that allows us to do that. The same way with Zostafax. If you're a senior and you're at risk for getting the shingles, you certainly want to get that Zostavax shot, as well as the new pneumonia shot, the Prevnar 13. Even if you've had a pneumonia shot before and you're over the age of 65, you need to get one more, which is a different strain. It's called Prevnar 13. Again, you don't require a prescription for your physician. Just come in with our collaborative agreement. We can give you that shot. Medicare, if you're over 65, pays for one pneumonia shot a year. If you had the Pneumovax 23 and now you want to get the Prevnar 13, you can get that. So please come in and protect the people that are in your family, and hopefully you will protect yourself.
Hey, Bill?
Yeah.
I just wanted to let you know that after we aired the program last week, when you were gone, we got a call from a lady from hospice. I believe she said she worked for hospice, that wanted a copy of the program because she wanted to take it back to her people because you had good information in there in regard to the Medi-Cal and Medicaid and stuff like that. So I was able to make a copy for her. Okay. And it gave that to her. So hopefully she's able to spread that with whoever it was that she wanted to spread that with. I don't know if that was coworkers. It sounded to me like it probably was coworkers.
Sure.
But anyway, I just thought I'd let you know that,
I appreciate that, and I'm glad it's helpful information. Our number is 263-5252 if you have any questions about anything that we're talking about. One of the questions, Paul, and you having a young child, people ask me, I have a child, and when do I call the doctor? Because most of the cough syrup medications now have been taken off the market for any child that's under three years old or under. You don't need to bring the child to the pediatrician every time your little one has a tickle in her throat, but sometimes coughs can signal more serious health problems. For children 3 months and younger, in general, you just want to check in with the pediatrician as soon as very young children appear ill. Minor colds can progress quickly into more serious conditions. We do not recommend a cough syrup for anybody that age. We used to. Now it's strictly acetaminophen and ibuprofen in small amounts. Occasional coughs really shouldn't cause a concern in case, in fact, they can really help your child by removing all that phlegm. And lots of times in a baby, you'll use a syringe and get that mucus out of their nose, which would eventually drain down into their lungs. But a cough lasting 2 to 3 weeks should prompt a visit to your healthcare practitioner. Sinus infections, asthma, or even reflux disease may be the cause of that undue hacking. If your child has trouble breathing, some causes of cough, such as croup, causes swelling of the airways that restricts oxygen flow. At first, they may be just sniffy and stuffy and have a mild cough, but eventually that becomes more like a barking noise, worsens at night, produces fatigue, and causes difficulty in eating and breathing, and then it becomes something major that you need to make sure that you go to a physician about. If you don't have a pediatrician, make sure you go to a physician who does treat children, because many of them don't. When your child's nostrils flare and breathing muscles move rapidly during a coughing spell, watch the skin above and below your children's ribs and above the collarbone. If you see those muscles react with each breath, it's time to check in with your healthcare provider. That indicates your child may have pneumonia. Again, this is the skin above and below the ribs and above the collarbone. That indicates that there's a potentially dangerous infection. And you can tell, you're a mom, you're a dad, you know nobody knows that child better than you do. So you know that every time, especially a pediatric where a child can't talk to you, you get so scared when you see them and they're not able to tell you what's wrong. There are visual signs that you can see. Other signs of pneumonia include a flaring nose, chest pain, fever, a bluish tint in the tips of the nails. Depending on whether your child has a bacterial or viral infection, your physician may prescribe antibiotics or other treatments, and check back with the healthcare provider if you see signs of worsening infection. That's one thing, Paul, even adults don't do. We prescribe as clinicians and physicians and pharmacists an antibiotic, many times without doing a smear to see what kind of bacteria is present. Mm-hmm. So we give you an antibiotic and say, if this doesn't get better, call me in 10 days or 2 weeks or whatever. Many people don't do that. And the reason those antibiotics don't work is you've got it's either a virus or it's a bacteria. Sure. that antibiotic doesn't treat. And in this day today, with such little time for physicians to spend with you as a patient, and lots of times in clinics we have rotating physicians or nurse practitioners who you don't see the same person the next time. You go to see a patient, a physician, and that's who you want to be your physician. We're finding more and more contract physicians now who contract out with several hospitals. They're here 2 or 3 days a week. They're someplace else 2 or 3 days a week, and nobody actually knows your history. It's there in black and white in your historical notes, but depending on how good those historical notes are is how good you get treated. If a cough comes with a high fever, and mild fever occurs when your child's body fights off an infection, then let your physician know that your little one's immune system is working to ward off a more serious illness. You may take simple steps to make it more comfortable, such as keeping the house cool and getting plenty of fluids. And even these vaporizers, sometimes when it's not going to cure an infection, but it's going to have the child breathe easier. And if you can get the temperature below 102, pick up the phone at that stage, and the fever could signal a more serious illness. So the takeaways are, if your intent or your infant is younger than 3 months, check in with your pediatrician or your healthcare provider as soon as your child appears ill. A cough lasting 2 to 3 weeks, and I don't know any mother or father that would let it go that long, that causes trouble breathing, should prompt a visit to your physician. Call your physician if there are symptoms of pneumonia, such as flaring nostrils, chest pain, or a bluish tint to the lips or nails. And also call if a cough is accompanied by a fever higher than 102. So that's something that I don't worry about too much because I've got grandkids and great-grandkids. But every once in a while they get a call from a great-granddaughter or a granddaughter saying, I need some help, Grandpa. What should I give my child? Then if the child is old enough, you choose a cough or a cold medicine for your child. And we have changed the way that we prescribe cough syrups for adults also. We used to say guaifenesin with codeine, Phenergan, promethazine with codeine. Anything with codeine is a cough suppressant. Even sometimes hydrocodone, before it became a Schedule II prescription, and acetaminophen was prescribed. Some people are prescribed just straight codeine tablets back from the old days. While I was back in Washington, D.C., I went to Alexandria, Dana and I, and we went to see a pharmacy called Slater's Pharmacy, Slater's Apothecary, that was opened in 1803. And it was a pharmacy until 1933. And then with the competition of, if you remember, Walgreens and those kind of stores started coming into effect during the Depression, they went out of business. Well, it's now a museum, and we were able to see a lot of the old formulas and a lot of the old cough syrups and a lot of the old herbs that they used to use. And if you look in the apothecary shop itself, the bottles are still there with some of the chemicals in them from 130 years ago. And it was really fascinating. I think my wife probably didn't think that was the greatest tour to take on a Monday before we left the next day, but we saw what it was like to be a pharmacist back in those days. And in those days, when I did my internship, actually, before going to pharmacy school, this didn't count. I was just working at a local pharmacy in southern Iowa. We had exact things just like that. We sold slippery elm bark. We sold willow bark. We sold glycerin, all kinds of old chemicals. And we knew which chemicals were poisonous. And one of those chemicals that was so poisonous we use today as digitalis or digoxin. And we use it to regulate the heartbeat. And but it's very, very poisonous if eaten. So you put those in different colored bottles so you would know those were poisonous and not to use. But when it comes to cough syrups, the cold and flu aisle at your drugstore is just full of brightly colored options. And you need to really look at those labels closely because most of them aren't just cough syrups. Most of them say cough and cold, which means they have some antihistamine or decongestant in them. Most of them say, or they say cough and sleep and have an antihistamine in it. So read the labels carefully. I mean, pay close attention to the age information on them now because we have taken the infants off of those. Frequently, I will go by body weight. If somebody tells me they've got to do something for this child's cough, and I'll find out how much they weigh and then suggest a reduced dosage. Also inspect the ingredients. Don't give aspirin or products containing aspirin to children younger than age 19. This policy or this medical practice came into being many, many years ago because they are consuming aspirin during the time that's linked to development of serious liver and a brain condition called Ray's syndrome. You know, I grew up, nobody knew all that, and I don't know how many people suffered Ray's syndrome, but the standard of practice now is no aspirin younger than age 19. So in a case like that, you would use acetaminophen, Tylenol, or ibuprofen. You have to treat young children a lot more cautiously, including those agents that you use against cough or cold medication to children younger than age 4. If your age of the child is between 4 and 6, then come to us or your physician. The medications probably won't help, and they may cause harmful side effects for children in this age group, and that's one of the reasons that they quit prescribing these things. They were loaded with dextromethorphan and codeine. Young children don't metabolize medications like adults do. So again, we try to use a practice of staying away from those things. Stick to the symptoms. Medicines can help ease a variety of cough and cold symptoms, from runny nose to cough to sore throat and fever. For older kids, a product that treats only those symptoms your child has. For instance, don't buy a cough and cold formula if your child only has the sniffles. That way you avoid the side effects of medications. And now you know we've taken the decongestants like pseudoephedrine out of cough syrups for children, and most cough syrups. Mainly the cough syrups now are Mucinex, which is guaifenesin, and dextromethorphan as a cough suppressant. The guaifenesin actually breaks up the congestion in the lungs, and if you add water to it, it will dilute that mixture in the lungs, and they will be able to get that out of their system much quicker. We're going to take a break. We're going to talk about, when we come back, about how elephant could hold your clues against cancer, and about those caramel apples you're probably going to have during Halloween. Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies. A few years ago, I went to Houston, Texas, where I spent a great deal of my time learning to compound prescriptions. Recently, I sent one of our local pharmacy technicians to Houston to perfect her compounding technique. And there are several reasons why pharmacists compound prescriptions. The most important reason is what we call non-compliance. For many reasons, people don't take their prescribed medications. Many patients are allergic to preservatives or dyes, or are sensitive to standard drug strengths. With the physician's consent, we can change the strength of that medication, the form of the medication, or even add flavor to make it easier to take. So in the near future, for your compounding needs for yourself or your pets, please check with Northlake Medical Pharmacies. And now we deliver free to Kelseyville, the Clear Lake Rivieras, Buckingham, and also to Lakeport, Nice, Lucerne, and Upper Lake. On Hill Road, next to Sutter Lakeside Hospital, or outside the Bruno Shop Smart at 347 Lakeport Boulevard.
I believe that home is where your pet is, and that loving an animal means never giving up on them, never letting them go.
I believe that when you adopt an animal from a shelter, you are saving not only one, but many lives.
And that when you spay or neuter your dogs and cats, you help decrease the number of homeless animals.
I believe it's time we do all we can to save the lives of homeless dogs and cats who are counting on us, because every dog and cat deserves a place to call home.
I believe that I found my best friend in a shelter, and that you can too. I'm Lisa Edelstein. I believe.
I'm Emmy Lou Harris. I believe.
I'm James Avery. I believe.
I'm Travis Clark. We believe that together with Best Friends Animal Society,
we can bring about a time when there are no more homeless pets.
Please visit our website at ambassadors.bestfriends.org to find out more.
Hi, I'm Mia Hamm. As a professional soccer player, I know how rewarding sports can be and how quickly injuries happen. So I've teamed up with the American Association of Orthodontists to ask athletes to play it safe. With my years of training, I know what it takes to become an expert, and orthodontists do too. They're the experts who help people obtain healthy, beautiful smiles. Wear mouthguards, face masks, and helmets to prevent injuries. Keep smiling and visit braces.org.
Imagine crossing a street busy with traffic. Against the light.
Watch where you're going!
Wearing a blindfold. Would you do this? Probably not. It's one risk obviously not worth taking. Some risks aren't as obvious, yet could be just as deadly, like the risk for type 2 diabetes. If you're overweight or over 45, if you're not very active, or don't eat as healthy as you should, there's an easy test you can take to find out your risk. It's free, and in less than a minute, you'll know if you're at risk for this deadly disease. Just go to diabetes.org/take-the-test or call 1-800-DIABETES. Because type 2 diabetes is one risk you can't afford to take. Take the diabetes risk test and stop diabetes before it stops you. A message from the American Diabetes Association.
Okay, we're back.
We are back, and we're going to be talking a little bit about how elephants hold the clue for fight against cancer. Paul, when I was in the airport, I saw this on the national news, and I bought a Time magazine, which was supposed to be all about that, and I couldn't get it condensed enough, and I went on CNN this morning and got a kind of a concise thing about it, but because they're giant, cancer-battling super creatures that destroy damaged cells long before they become cancerous, that's how they beat it. They destroy a cancer cell before it actually does any damage. Well, there was a study released this week. Scientists said that elephant genes may provide a crucial clue to fight against human cancer. They rarely get cancer, which has long bewildered scientists, considering elephants have 100 times as many cells as we do. They should be 100 times more likely to have a cell slip into a cancerous state and trigger the disease over their lifelong span of 50 to 70 years. And this took place at the University of Utah. That's where the study took place. Well, they tried to find out why. They had a team of scientists from Utah and Arizona State. And in search for the answers, they combed through the elephant DNA and found a few deviations. Elephants have extra genes that stop tumors long before they form. And they have at least 40 copies of those genes that are a code for P53, which is a protein that's well known for its cancer-inhibiting properties. In comparison, we only have 2 copies of such genes. The massive animals also detect damaged cells preemptively which they repair or they kill. So they may have a more robust mechanism for killing damaged cells that are at risk for becoming cancerous. We don't know those cells, but for some reason the elephants do. So during the study, the scientists extracted white blood cells from elephants and damaged the cells. It's as if the elephant said, it's so important that we don't get cancer, we're going to kill the cell and start over fresh. If you kill the damaged cell, it's gone. That way it can't turn into cancer. This may be more effective an approach to cancer prevention than trying to stop a mutated cell from dividing, because that's what we do now. When we go to kill a cancer cell, what happens with a cancer cell? It mutates so quickly that it becomes millions of cells instead of just one. So what it means for human treatment, we're not sure. Without the genetic cancer-fighting ability, elephants would be long gone. By all logical reasoning, elephants should be developing a tremendous amount of cancer and, in fact, should be extinct by now due to such a high risk for cancer. We think that making more P53, which is that cell that fights cancer, is nature's way of keeping the species alive. While there are other contributing factors that makes humans more at risk of getting cancer, for example, elephants don't smoke, elephants don't drink, nature has already figured out how to prevent cancer. So it's up to us to learn how different animals tackle the problem so we can adapt these strategies to prevent dangerous cancer in people. Now, it's not only smoking and drinking, it's our environment, it's our exposure to different chemicals that are in the system. It's a lot of different things that we really can't control unless we live in an environment that has nothing but pure cells. And in that kind of a society, your immune system doesn't build any kind of a defense system to protect you. So are we any better off? I bought all kinds of papers while I was in Washington, just trying to see what if I could find anything different about health. And I was looking at the USA Today from yesterday, and I found out that Eli Lilly, which used to be one of the largest and most ethical drug companies there was, and I'm not saying it isn't now, but I'm not sure we have any company that's ethical or moral anymore, but have pulled their drug off the market that they were using to treat for arteriosclerosis, and they expect to take a $90 million pre-tax charge to account for the drug's discontinuation. So they're going to take a $90 million loss and turn it into a tax deferment. Lilly said it has ended late development of the drug as part of a costly study involving 12,000 patients at 540 sites in 37 countries. It was in phase 3 development, the stage before a drug can be submitted to the FDA for approval. The failure to bring the drug to the market reflects a significant setback for Lilly, which saw shares fall more than 10% to $77 in pre-market trading before regaining some ground. So an independent study suggested there was a low probability that the study could achieve the primary end based on results to date. So I don't think it fundamentally changes the company or their overall policy, but the drug was supposed to treat people who are at a high risk of arteriosclerosis, cardiovascular disease, and it displayed insufficient efficacy. So this goes on all the time in the drug field, and a lot of those drugs get into the marketplace, and people continue to buy them because the detail companies continue to tell you that they are available and they will make your life longer and a better quality of life. So we buy into the Kool-Aid, and many times it isn't Kool-Aid. Many times it's actually the truth. But I see so many new drugs coming on the market now, and the price of those new drugs, I just think of what that's going to do. We look at hepatitis C, and although I don't have hepatitis C, there are many people that do. The cost of Harvoni is $84,000 for a treatment to get rid of hepatitis C. That's $84,000.
That's insane.
And these drugs for MS that are coming out are expensive. And as I was telling you on the show last week about people who need chemotherapy to survive, and the drug it's an experimental drug. It used to cost the patient nothing if they would sign a waiver. Now the patient has to pay for it, and the copay is $2,000 on a $9,000 prescription. So I know our healthcare has to change. I know we have to go a different direction. But to make someone who's terminal or trying to keep from being terminal pay that kind of money for an experiment doesn't seem fair to me. All right, you ready for this, Paul?
I'm ready.
Caramel apples.
Yep.
You eat caramel apples?
I've had them.
And you like them?
I do.
We went by in Washington, D.C., they're putting up everything for Christmas already.
I know, yeah.
As they are here.
I've seen that here, too.
But in the candy stores, it's all full of caramel apples and those kind of things.
I like them with nuts.
They're a classic fall favorite, and they're served up in a variety of ways. But a new study published in the American Society for Microbiology alerts consumers that if they're made incorrectly, sickening bacteria, which is listeria, could grow under the caramel-coated surface.
That happened.
It'll be interesting. Yes, it did.
Mm-hmm.
And it's interesting to find out how and why this happens. Researchers from the University of Wisconsin-Madison's Food Research Institute, where I go for my board meetings, did a study after this outbreak late in 2014 in which 35 people were infected and 7 died. Researchers began investigating the cause. They interviewed 31 of the victims and found that before falling ill, 90% of them ate commercially produced and prepackaged caramel apples. 3 different manufacturers recalled their caramel apples as a preventative measure. The damage was already done. Listeria is that genus of bacteria typically found in soil, water, and some poultry and cattle. It's unique that it can grow and thrive in cold temperatures like a refrigerator. So When consumed, that Listeria bacteria causes fever, stiff neck, confusion, weaknesses, vomiting, diarrhea. It's like all these drugs that are advertised on television now. There's one for MS, I think, that says, and if you develop this, you surely will die. It doesn't tell you who to call, but the study's lead author and director of the Institute, Kathleen Glass, explained that it doesn't normally grow on apples, or it doesn't normally grow on caramel, why it's such an unusual and difficult outbreak to track. But this is how it grows. When a stick is inserted into the apple, it causes just enough juice to surface and get trapped under a layer of caramel. It creates an ideal environment for Listeria to grow. If already present on the apple surface, moisture and room temperature accelerate that growth up to 1,000%. Her and her colleagues created a cocktail of 4 strains linked to the outbreak, testing with Granny Smith apples. They swabbed different strains on the skin of the apples, but only inserted wooden sticks into half of them. All of those apples were then dipped into hot caramel using tongs or by holding them in classic way with sticks. They were stored at either room temperature, which was 77 degrees, or refrigerated temperature. Just 3 days at room temperature was all the bacteria needed to grow 1,000% if the apples had sticks. Without sticks, Listeria growth was delayed when stored at room temperature. It significantly decreased on apples with sticks stored in the refrigerator for up to a week. Stickless apples stored in the refrigerator had no Listeria strength over the course of 4 weeks. The hot caramel kills a lot of bacteria off the surface. However, those that survived were the ones that were able to grow. If someone ate those apples fresh, they probably wouldn't get sick. But because those caramel apples are typically set out at room temperature for multiple days, maybe up to 2 weeks, it's enough time for the bacteria to grow. So they recommend purchasing only apples that have been refrigerated or eating them fresh in order to drastically decrease ingesting Listeria. So here you go, putting a big damper on your Halloween.
Yeah, it's a bummer.
You'll just have to eat more candy, and that's not good for you.
No, it's not.
Are you still eating sunflower seeds?
Yes,
the same kind? Or
same kind, low sodium.
Low sodium.
Yeah.
And just plain sunflower seeds?
That's it. Yeah. Today I'm having a Clamato.
Oh, you're getting healthy.
You ever drink Clamatos?
Yeah, I like Clamato.
Yeah, very good.
They make good Bloody Marys. What I've heard. I miss the Derby
There
Hat
may or
Club
may not be
fishing
some, something going on in there. Can't say for sure.
Well, usually I go to the Derby Hat Fishing Club trip, and that was this weekend. I was in Washington, D.C.
Oh, you missed it.
And sometimes we have libations and a Bloody Mary in the morning or something similar.
Absolutely.
But I didn't this time. I was at board meetings and staff meetings and behaved myself and had.
It's funny when I travel, when I go on planes, I like drinking Bloody Mary juice, even without the alcohol.
Really?
I don't know why. It just seems like a traveling thing for me.
Well, you talk about eating salt. Do you know how much salt is in tomato juice?
Probably a lot.
An incredible amount.
Yeah. This is probably why I love it so much.
And people I know, as soon as they get tomato juice, they sprinkle salt and pepper on it and then drink it. They overlook at the milligrams of salt in there.
Wow, yeah.
Well, since you've been talking about health, and we have been off the air as well as on the air, a New York Times article this morning, and it didn't really surprise me, and it talked about how a placebo, you know what a placebo is, right?
Placebo is a fake pill that they give in testing for medicine.
And it makes you, the goal is to make you think that you are taking medication. If you believe that anyone who exercises knows from experience that our minds and mental attitudes are affected by physical performance, that's true. Who hasn't faced a moment when getting tired at the end of a strenuous workout or race and we're about to quit before suddenly realizing we're being passed on the path or shown up at the gym by someone we know we should outperform? So we're looking for a way where we can get an extra unexploited boost and spurt on. This phenomenon is familiar to physiologists, many of whom believe our brains, in order to protect our bodies, send out signals telling those bodies to quit. I think mine works a little early. I think I might have a short edit saying don't keep going. Before every single source in our muscles and other tissue is exhausted. Now, I swim a mile a day, and I'm at the end of the mile a day, my muscles don't say quit. I have a friend that wants me to do the shark swim from Albuquerque from the coast to the prison, and down in San Francisco, and the water temperature is about 55, 56 degrees, and I'm not sure that I can do that. I can swim the distance, but whether or not my muscles at that kind of temperature will allow me to do that. But that phenomenon, which orders our cells to stop, we think are at the outer limits of endurance at strength, when in reality we may have still the physical reserve available to us if we can find a way to tap it. So that time when you feel like you're going to pass out, or your muscles are all going to cramp up, and I have that early in my workout swimming. It takes me about 10 minutes before I can get to the point where my muscles get into the mode of relaxing and getting through the workout. So prior to that time, sometimes I'm almost able to quit, yet my brain tells me, you can do this, you can swim this hour, you've been doing it for 55 minutes a day for as long as I can remember, and you can keep doing it. So past studies have shown that lying to people is one of the best ways to exploit that reserve, telling athletes they're moving slower, in fact, that they are. That used to work in basic training and going to the military. They would tell you you're much slower and you needed a faster time and you could do it, or playing football. Or give them a sugar pill that they think contains caffeine or steroids, and they will run swiftly or lift more weight before. But none of those studies tested the effects of placebos and deception in the relatively real-world competitive situations, which have had their effects on mental and mental responses and your responses to stimuli. People are almost always faster during competitive races than in training studies show, even when they're trying to replicate race pace. So in competition, most people might already be using that last reserve of physical capability, or there may still be some wiggle room there. So to find out, the University of Glasgow recruited 15 male recreational numbers for a test of what the volunteers were told was a legal form of erythropoietin, EPO, and that's what people like our racers increases the number of blood cells, which red blood cells carry oxygen, and that means more oxygen is being carried to taken to the muscles, and endurance performance improves. But the runners were assured this was a formulation of EPO that was legal for the use in research and would have few harmful side effects since the dosage was much lower. On the other hand, the runners were told the drug should improve athletic performance since it would increase red blood cells. The drug, however, wasn't EPO. It was saline, which is salt water, which would be given by injection, since past research has showed that the placebo effect tends to be stronger when something is actually injected rather than swallowed. So before starting the drug regimen, the volunteers competed in the 3-kilometer track race to determine the baseline finishing time. Some of the men continued their normal training for a week, while others received injections of the drugs. They all raced again. Finally, for another week, the men switched with those who had received the shot before getting injections, and now vice versa. Then they all ran a final 3-kilometer race. Throughout, the scientists collected data about how the men felt physically and psychologically during their workout and the races. As it turned out, almost all of them felt the drug had real and substantial effects. The runners told the scientists that during the week when they were receiving the injections, their workouts felt easier. They were more motivated to push. One man told them, according to the new study they had noticed in the gym, that I was doing a lot more in my sets than normal and also running. I did feel less tired. And they also recovered much quicker. They all significantly improved their 3-kilometer race times by 1.5%, which is probably just enough to win. They did not show much, if any, change in their race times after the control week. So it had a meaningful enhancing effect. Of course, that was a small study, and I'm not one for small studies. But I thought it was substantial enough to at least talk about, because back in the days when I first started in pharmacy school, physicians would prescribe placebos a lot to people and tell them they were prescribing an active drug, and it had really magnificent effects on many, many people. So it is not unusual to see something like this. I had one last thing here in opiates, because it's been such a serious thing. Despite the serious problem we've had in the last 10 years, there's been a dramatic rise in prescription painkiller deaths. But the percentage of people getting treatment for opiate use has remained about the same, even though we're having interventions like we have. The researchers identified in their last rate over 8,200 people died of heroin-related overdoses between 2002 and 2013. That more than doubled during this last period. The study is something that researchers compared time frames from 2004 to 2008 and 2009 to 2013. The percentage of the population using heroin jumped from 24% in the first frame to 35% in the second frame. And the big reason we talked about is because it's cheaper. Private doctors are increasingly prescribing a drug called buprenorphine, which aids in the management of cravings and helpfully reduces opioid use. The real challenge is getting more people in settings where they can get some of these drugs. But we also need to think about changing the conversation about opiate addiction, which is chronic. Some of these people may be open to treatment options, but choose not to seek them. So, wow. Well, got to tell you, we're running out of time. North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next week for Health Talk on AM 1270 and 96.5 FM KXBX in Lakeport.